Thank you, Mr. Turner. Mr. Conley?
Thank you, Mr. Chairman. And I would yield to the distinguished ranking member of the committee if he wishes to.
Thank you very much. I want to thank the gentleman for yielding. I want to discuss what a conviction for marijuana possession, no matter how small, means for most individuals across the country. With a conviction, a person loses the right to vote, federal financial aid and public housing assistance. Conviction erodes employment opportunities and future earning potential. And I can tell you that I live in a neighborhood where The Wire was filmed. And so I see a lot of young men who have basically been sentenced to a life term of not being able to move as a normal citizen would in this society. Deputy Director, let me ask you this. Isn't it true that convictions for even minor nonviolent drug possession have a significant negative effect on an individual, their families, community, and the nation? Would you agree with that?
I would, sir. And by way of context, when Director Kurlikowski took this position, Director Kurlikowski is the Director of Office of National Drug Control Policy, former police chief in Buffalo and Seattle, took this position. He clearly articulated that we cannot arrest our way out of the problem, that what we need to do is really have a robust strategy reflecting on our strategy of prevention, intervention, and treatment, and a series of criminal justice reforms that does everything we can to divert people away from the criminal justice problem. And I can tell you, I was in Massachusetts at the time as the director, and it really signaled to me an important shift in drug policy, away from a war on drugs approach, and really looking at this as a public health-related issue, particularly as it relates to the racial and ethnic disparities that we see as it relates to drug use. Part of the role of our office is to also look at what are the impediments for those people in recovery like me who often do have criminal records, and what does that impairment mean in terms of their ability to have a vibrant life in the community and seek meaningful employment and meaningful housing. And so to that end, we've been focusing on actions to diminish those barriers. So clearly those issues are important to us. I think you will find that they're reflected in our strategy in making sure that we are not dealing with this just as a public safety issue, but how we think about prevention, treatment, recovery support, and again, looking at smart criminal justice reforms to make sure that we are not incarcerating people for low-level nonviolent offenders. I think, as you know, Department of Justice has been supporting many states' efforts around justice reinvestment and are clearly understanding, both from an economic perspective and a humane perspective, we can't continue to incarcerate our way out of the.
Well, let me ask you this. What is so how do you all interact, that is ONDCP, with the Justice Department? Because and with regard to when you got some states saying recreational drugs, you can purchase them, and then most states saying you go to jail. I mean, so how do you all? And I think that's what this hearing was trying to get to. I mean, where are we going with that? Because it just seems so incredibly unfair that you would have a situation, and like I said, I see people that are affected by these laws every day. On the other hand, I am also concerned, very much so, and Mr. Michael, remember when he and I were involved in the Criminal Justice Subcommittee, we both are very concerned about the effects of marijuana. So how do you all try to strike that balance?
I would say, Representative, that that's the entire position of our strategy, that it's not kind of war on drugs, arrest people, send them to jail on one hand, and quite honestly, legalize as the silver bullet to our problem. that we believe in a much more balanced and middle-of-the-road approach that deals with this as a public health-related issue. So, and the primary way that we do that is by setting the administration's national drug control strategy. And obviously that's sent and transmitted to Congress. And a big portion of that is really about smart criminal justice and innovative criminal justice reforms that look at not incarcerating people, not arresting people for low-level violent use, but making sure that folks have access to a wide variety of public health interventions.
And I just want to make sure you're clear. It's just not the incarceration. You're right. I mean, when a person gets a record, they are doomed for life. So it's just not the incarceration. I see my time is up, Mr. Chairman. Thank you.
Would the chairman just allow me
Go right ahead,
to if the distinguished ranking member would yield?
Of course.
You and I have worked together on problems involving the ability of people to cast a vote. To your very last point, Mr. Cummings, is it not true that among the things that affects them for life, it can also affect their ability to participate in the electoral system?
Claim my time, yes.
I thank the chair.
Okay. Well, Mr. Botticelli, you are the Deputy Director of the Office of National Drug Control Policy. That office is under the White House, right? Now, when the President said, where's the statement here? He said, I don't think, referring to marijuana is more dangerous than alcohol. What was your reaction?
I think the administration's policy has been consistent as it relates to.
But he is the chief executive, and the office that you're in, it was set up under the White House to report to the President. You just got through saying that it is dangerous. We continue to spend resources to try to stop children and others. You also said since the beginning of 2007 to most recent statistics, we've seen an increase in adolescent use and abuse. Then the President said it's important that we go forward. He was speaking of legalization because it's important for society not to have a situation where a large portion of people have at one time broken the law and only a select few are punished. I mean, this is in conflict with what you were using taxpayer dollars to try to avoid. You just got through also testifying 314,000, is that in treatment for marijuana, which is only surpassed by alcohol and abuse, is that correct?
That's correct.
So we have more youth, which is there anybody here that wants to legalize this for adolescents? I don't think so, but we're getting more hooked, and the President comes out with this statement. I'm afraid, too, we've gone from just say no, and then we had I didn't inhale, and then now it's just say maybe or just go ahead. And it does concern me because our youth are the most impressionable. I was asking our staff, because when I was here, I remember turning to a political consultant, a little bit controversial, but one of the best in the business, Dick Morris. And I'd worked on some campaigns with him, and I said, and Dick Morris, I believe, lost his brother to substance abuse. And Dick was convinced that the way to change public opinion was with ads and you can change public opinions in that regard. And that's where we launched some of our ads. We originally were trying to get the media, which is about as slack as you can get in putting up ads, even though we control the airwaves and they're supposed to be free. But then I think the deal we cut with Clinton was to have half paid and half donated time. Are we still doing those ads?
So
to influence public opinion in young people, you have ads. Now we have emails. We have Twitter and texting and a whole host of social medias. Are we paying taxpayer money to use those techniques, which are supposed to be the most effective, to try to curtail? Again, I think we'd start with adolescents. Adults are one thing, but adolescents. are we doing that?
Our office has been administering the Above the Influence campaign, which uses a wide variety of largely social media techniques.
Have we dropped
Get
going after marijuana? Have we dropped going after marijuana? Do we have any ads on marijuana? I mean, we've done a great job on tobacco, particularly in the last few years.
Correct.
But what about marijuana?
So I've been doing prevention work for a long time for a wide variety of areas. I actually, in Massachusetts, tobacco control was under my authority as well as substance use. And I think what we know in terms of prevention science is that often we have to focus on providing youth with resiliency skills to resist a wide variety of substances.
But you're not answering my question. Is the United States of America under the Office of National Drug Control Policy or any of the program, do we have any programs that you're aware of that are advertising to change the behavior of adolescents in regard to marijuana today?
Yes, we are. As that program.
Maybe you could provide us with some copies. I'd like to see what we're doing.
Sure.
Because the law is going in a different way in some of the states. I mean, we haven't even gotten into the conflict using law enforcement resources. Mr. Turner just talked about them coming in, raiding federal authorities in states which have now taken measures and other people have taken advantage of. But I'm concerned, again, the trend with young people. I'm not sure where we're going to go with this whole thing. I have my own opinions. I was talking with Mr. Conley. He has his. There's the medical marijuana use issues. There's the recreational use. There's the legalization use. But I think we have the most schizophrenic policy I've ever seen as far as dealing with a social issue, and again with laws that are in conflict with public spending, which is in great conflict.
So one of the things that I can say, both in terms of the public information campaign that we've been running, as well as our drug-free communities programs that have both had independent evaluations in their success, that with our drug-free coalitions and through independent evaluation of our Above the Influence campaign, that we've been able to make significant progress, that we have evidence of effectiveness of a wide variety of our prevention programs. And I agree, I think many of those strategies were adapted from tobacco campaign programs in terms of how you provide those messages to youth.
Well, again, we've had some successes, but I don't know exactly how much money we've been spending. We're going to find that out for the record. You're going to provide it to the committee. It doesn't sound like we've had much success. You just testified actually increase in some of those categories, got large number in treatment. Then the icing on the cake is, by the way, our new health care will cover it, so don't worry, you're covered for treatment. Once you get to treatment, you're pretty bad off. Let me ask you a question. When Mr. Cummings and I chaired the subcommittee, everyone we had come before us said that marijuana is a gateway drug. Most people who go to the other harder drugs end up or start up with marijuana. Is that still the case, or has that changed? They going straight to other drugs now?
So let me respond to a number of questions that you've raised here. So first and foremost, if you look at a wide variety of drug use indicators in the United States, that we have made significant progress in many areas. We've seen reductions in youth use of alcohol. We've seen reductions in cocaine. We've seen recent reductions in prescription drug use. So I think we've seen that and those are direct areas of focus for our national drug control policy.
I met with my local police officers last week for breakfast, and they told me two things. They said it's not getting any better. I mean, it looks like that some of the deaths have dropped, but they said that's only because they've got better treatment. They're catching them, but actually the incidents are up, and they shift from drugs. It's now because of this, there isn't much risk. It's socially acceptable go to marijuana, but the kids are also the adult population too is shifting back to methamphetamines and prescription drugs, as you know, as Spiro misuse of them has spiraled out of control.
But your point in terms of the increase in terms of marijuana use, I think is particularly important. And if you talk to Dr. Nora Volkow, who is the director of the National Institute on Drug Abuse, kind of the preeminent researcher in this area, we support most of the world's major research as it relates to drug and drug-related issues. She will tell you that, prevention science tells us that when people see things as less risky, think of yourself and your own behavior, that you're more likely to do it. One of the reasons why we've had success with tobacco is kids see it as risky. And unfortunately, kids no longer see, the vast majority of kids no longer see marijuana as risky. So it's no surprise,
after
that
the president's statement, too, when he said it's no different than alcohol, would you, again, we have the D here. I'm only reciting what others have said. The DEA chief, one of their chiefs said he viewed last Wednesday, I guess it was called the legalization of marijuana at the state level, reckless and irresponsible, warning that the movement to decriminalize the sale of pot in the United States will have serious consequences. Do you agree or disagree with that?
Again, the administration position has not changed as it relates
so
to
you
legalization.
agree? You agree what he says?
The president has indicated that this is a public health challenge and that we need to deal with it as a public health challenge.
Well, again, the president may. I didn't start this. The president made his comments. And now you have different agencies, including yourself, under the president saying something different than what we're hearing in some quarters. So with that, let me go. Mr. Day, you haven't asked questions. I'm sorry, Mr. Conley, because you yielded.
Thank you, Mr. Chairman. Welcome, Mr. Botticelli.
Thank you.
And let me just say I've enjoyed your paintings for many years. Thank you very much.
I wish I could say that
We're
I
honored.
inherited any of
I
that
know, I
ability.
couldn't resist. Are you from Massachusetts, by the way, originally?
I am
Where?
from Massachusetts. I lived outside of Boston in Malden, Massachusetts.
Malden. I'm from Brighton and Alston.
Oh, you are?
And I can talk like that if I have to.
My first apartment was on Comm Avenue.
All right. Well, glad to have you here. To this point about the president's statement, holding in abeyance whether he should have made it or what he intended from it, how many people die from marijuana overdoses every year?
Mm-hmm. I don't know that. I know it's very rare for someone.
Very rare.
Yep.
Now, just contrast that. Prescription drugs, unintentional deaths from prescription drugs, one American dies every 19 minutes. Nothing comparable in marijuana. Is that correct?
Correct.
Alcohol. Hundreds of thousands of people die every year from alcohol-related deaths. Automobiles, liver disease, esophageal cancers, blood poisoning from too much toxicity from alcohol. Is that not correct?
But
Mr. Botticelli, is that correct?
I think the way that you have to look at this is that the totality of harm that's associated with a substance, and to basically say that because marijuana doesn't have the lethality and the overdose potential that heroin or alcohol does, diminishes, I think, the significant health consequences that are associated with the drug.
Well, I guess I'm sticking with the president, the head of your administration, who was making a different point. And he was making a point that is empirically true. That isn't a normative statement that marijuana is good or bad, but he was contrasting it with alcohol. And empirically, he's correct, is he not?
I think the point here is that the administration's position has not changed.
Mr. Botticelli, I'm not asking you that question.
And that when you look at alcohol and substance use, that we have to look, or marijuana, that we have to look at this as a public health related issue. So, I have to say this morning,
Mr. Botticelli, excuse me, no. I'm asking the questions here, Mr. Botticelli, and I'm directing you to answer them. If you want to add your opinion, fine. But is it not a scientific fact that there's nothing comparable with marijuana? And I'm not saying it's good or bad, but when we look at deaths and illnesses, alcohol, other hard drugs are certainly, even prescription drugs, are a threat to public health in a way that just isolated marijuana is not. Isn't that a scientific fact? Or do you dispute that fact?
No, I don't dispute that fact.
Okay.
But may I continue?
Well, just a second.
I think
I hear bric-a-brats being thrown at the president as if he did something reckless. And my view is he was trying to put this in perspective, because there are states that have decided to go down a different path. And my friends on the other side of the aisle are all for states' rights when it comes to guns or gay marriage or other things. But apparently in this case, states have no business getting in the drug business. And yet I look at the war on drugs, and let me ask you this question. It looks to me like public opinion has shifted profoundly. 20 states and the District of Columbia now allow marijuana to be used for medical purposes, and 2 states by law in referendum just voted to legalize, regulate, and tax the recreational use of marijuana. That's almost half the country. It seems to me, and then if you look at polling, in 1969, when the war on drugs began under Richard Nixon, only 12% of the population supported legalizing marijuana. That same percentage today is 52%. That's a huge change in public opinion. Given all of the efforts, again, as the chairman said, just say no under Nancy Reagan and all kinds of PSAs on television and radio and newspaper, and trying to make sure that we highlighted how dangerous drug use of any kind could be, why do you think public opinion has shifted so dramatically on the issue of marijuana?
Again, from my standpoint, and I'll speak candidly, that I am not sure the public is getting a fair and accurate view, particularly as it relates to the public health consequences of marijuana. I think that it's been portrayed as a benign substance. I don't think that they fully understand or have gotten information to really understand the magnitude of the issue. So, I think that that's part of the issue. When, clearly, and we've seen this with other substances, we've seen this with prescription drug abuse, that when people see something that is legal, when they see it, that it's often prescribed by a physician, people see it as benign and not harmful. And so it's not a surprise for me to see that change in public perception.
Well, all right, let me pick up on the point you're making. First of all, this whole issue of, is it a gateway drug? Is there empirical evidence that, in fact, it is a gateway drug? Can we empirically correlate the use of marijuana to then moving on to other more dangerous substances?
So we know that the earlier that someone, and particularly in adolescence, uses marijuana, the more likely they are to develop a dependence and go on to more significant issues. So, and if you look at those folks who have an opiate disorder, prescription drugs, or heroin, they will often tell you, and you will often see, that they started with early tobacco, early alcohol, and early marijuana use. But
Mr. Botticelli, wait a minute. That's a logical fallacy. Yes, that's true, but that begs the question of the fact that millions of Americans, Mr. Blumenauer, I think, cited 50 million,